Tonight's Eye on America will hit home for the estimated 53 million people in this country who are taking care of an aging family member. They're often forced to dip into their savings or adjust their work hours to make it all happen. Mark Strassman looked into what's being done to care for the caregivers.
Ready? One, two, three.
We met Yanira Portondo working her second full-time job. It's caring for her mother, Gladys Ortiz, in their Miami home.
Bella. Bella.
Since 2017, 3 generations of this family have looked after Mrs. Ortiz, now 83. Aging can be unkind. She struggles with Parkinson's and dementia, and the list of her challenges goes on.
She's having hallucinations. Sometimes she doesn't recognize me. There are days that going from the living room to the bathroom, she gets lost.
24/7, no matter what you're doing, you're making sure that somebody is here.
Yes.
Looking
yes.
after her.
Yes.
Because without that help,
she's in danger. She wouldn't last a week by herself. Not caring for her it will be criminal.
this family's luckier than some. Medicaid pays for a home care aide to pitch in 38 hours a week, but that still leaves 130 hours in a week, every week, where the family's spending time and money on her round-the-clock care. Everyone has a life of their own, of course, but the priority is making sure that she's okay.
We try to make sure that everybody's needs are met.
Every day on average, another 10,000 Americans turn 65, and at some point, 70% of them will need long-term care.
I'm a physician by training. So
Dr. Maisha Minter-Jordan is the CEO of the AARP. She told us the cost and the workforce required for long-term family care is one of their priority issues.
If you're not a caregiver, you either need caregiving or you will become a caregiver.
Is it a crisis?
I definitely think it is a crisis. How do I make decisions about their care? How do I have the financial means to be able to do this?
In the U.S., family caregivers, on average, spend a quarter of their income taking care of loved ones. It can be emotionally and financially draining. Washington State added a payroll tax, money now used to fund long-term care insurance for its residents. A dozen other states are considering variations of long-term care taxes. The AARP is also advocating for a $5,000 federal tax credit to benefit caregiving families.
It's about recognizing the humanity in each other's.
Because it's not going away.
And it's not going away, and the problem is only going to continue to increase.
Yanira Portondo worries about something else. In 20 years, will her daughter have to care for her?
I could have never imagined I was going to be in this position, ever.
You're exhausted.
Yes, I am. Most of the time I'm exhausted, yes. Mamacita. But every time she gives me one of those smiles, it gives me a little strength to keep going.
For millions of American families, caregiving is a labor of love that can demand every bit of both. For Eye on America, Mark Strassman in Miami.
On any given night, more than 140,000 Americans 55 years or older experience homelessness, and it's estimated that number could nearly triple by 2030. In tonight's In Depth, CBS's Elise Preston reports on what's causing the surge and what's being done to address the growing crisis.
Good morning, Rose.
This is no ordinary house call.
It's Daniel from Healthcare in Action.
A medical team arrived at this RV to treat Rose Del Rosario, who is 65 years old and unhoused.
Let's go around the side because we got the little...
Her vitals are taken inside a medical van parked across the street. Del Rosario suffers from high blood pressure and lifelong asthma.
You were battling asthma without any treatment.
What I did was I would buy inhalers off people that were out here that found them in the trash.
Did you feel safe using those inhalers from...
Not really.
She says she had no money left after her husband died several years ago, and she wound up on the streets.
May I ask what it feels like to be navigating all of this at the age of 65?
It makes you feel older. I feel like it's aging me, you know. I feel like it's aging me a lot. Yeah, that's about it. It's just tiring. It's just hard to live like this.
According to a federal report, about 20% of people experiencing homelessness in America last year were 55 and older. It's usually caused by the death of a spouse, divorce, job loss, eviction, or mounting health issues. Daniel Speller is a physician associate for Healthcare in Action, a nonprofit organization that provides medical care and housing assistance for those without permanent shelter, including older adults.
You're not having any chest pain today? These are folks who are kind of entering the stage where they're starting to have, multiple complex chronic medical conditions that need to be met, and they're just not being met. Heart disease, diabetes, a lot of pain, a lot of mental health issues. They're also the most vulnerable.
Dr. Indu Sabaya is Healthcare in Action CEO. She fears the impact rising costs and cuts to government programs like Medicaid will have on seniors.
If there are cuts to Medicaid, what happens to them?
I don't believe we should be cutting Medicaid for those populations. We should leave those intact, and that will be so helpful to people not falling further into the hole.
At 65, where did you think you would be for retirement?
In a nice, comfortable rocking chair, waiting for this casserole to come out of the oven. I didn't think it would be like this.
Despite her struggles, there's a glimmer of hope. Kindness helping her survive. Elise Preston, CBS News, Los Angeles.
More than 70% of the nation's nursing homes are now owned by for-profit companies, often backed by private equity or real estate investors. New research is raising troubling questions about their quality of care. CBS News contributor Lisa Ling first encountered these questions through her own family's experience, but soon found out she's not alone. Here's tonight's Eye on America.
This is Berkeley East, a for-profit skilled nursing facility in Southern California, where my 92-year-old mother-in-law, Grace Song, spent a month after a hospitalization.
When you go through all this stress, I'm just so deadly tired.
I began recording her during my visits after she told me she struggled to get the attention of staff, and medication she says she was told to take promptly at 8 a.m. routinely came hours late.
So then you're starting to panic because so much time is
passing by. So I was pushing the buzz to find out what's going on.
One night, my mother-in-law, who was a fall risk, was left alone in the bathroom and fell. She hit her head and was sent back to the ER.
This is where you feel, how did I get to be so helpless?
More than 70% of U.S. nursing homes are now run by for-profit companies, and there's growing evidence patients are paying the price. Harvard professor David Grabowski is an expert on nursing home policy.
The vast majority of quality problems in the U.S. are centered in for-profit nursing homes.
Most U.S. nursing homes rely on taxpayer money from Medicare and Medicaid. Grabowski told us as profit-seeking investors have poured in, it's become more difficult to track where the money goes.
We really don't know kind of how they're using public dollars and whether they're actually going into direct resident care.
What is clear from federal research, many of these facilities have been found to have lower staffing and worse quality of care. In 2019, Berkeley East was taken over by a for-profit company called Aspen Skilled Healthcare, a mid-sized chain of more than 24 nursing homes.
How often were you exposed to examples of gross negligence?
It felt like on a daily basis.
This nurse, who asked to appear in shadow, left Berkeley East after working there more than a decade. She was one of 5 current and recent former employees who told CBS News patient care had been compromised after Aspen took over.
What would you say the biggest changes were?
When we try to call upper management, they wouldn't even pick up the phone or call us back. They would just leave us short on the floor.
Berkeley East has racked up so many serious quality issues that regulators say it requires special oversight to protect residents' health and safety, and dropped it from an overall 4-star rating to 1.
Labs weren't being reported in a timely manner. Patients weren't given their medications on time.
She also alleges that during the pandemic, Aspen took steps to conceal staff shortages from the state health department by listing names of nurses who appeared not to be working there on internal staff reports.
These nurses were nowhere to be found in the system.
While Berkeley East operated at a loss, data from its most recent financial records show overall Aspen's facilities reported more than $27 million in annual profits.
Where do you believe that money was going?
It was going to corporate.
My mother-in-law wasn't the only one who felt ignored. On one visit, her roommate said she couldn't find staff to change her.
I have no idea when she's coming back.
Aspen Skilled Healthcare declined to comment for this report. It recently replaced managers at Berkeley East and has reported staff levels that exceed state and federal requirements. In a statement, an industry lobbying group said it supports financial transparency and accountability, but says these issues distract from others like chronic government underfunding and a growing worker shortage. Nora?
Lisa, thank you for your reporting. With more seniors in the U.S. than ever before, nearly 56 million, according to the last census, we've been taking a closer look at a growing trend in nursing homes. Many are now backed by profit-seeking investors from real estate and private equity. In tonight's Eye on America, CBS News contributor Lisa Ling has part 2 of our investigation into claims these facilities may have neglected patients in pursuit of profits.
That's where all the complications started. At Oakland Heights.
Oakland Heights is the nursing home where 85-year-old Ruby Frazier spent a month after a fall sent her to the hospital in November 2022. Her granddaughter Maisha and daughter Yolanda told us Ruby struggled to get the attention of staff.
My mom would push the button for help, and they wouldn't acknowledge her.
How often was she telling you this?
Every time
All
we
the time.
Maisha and Yolanda say they watched as Ruby's condition quickly deteriorated until one visit when Ruby, who was bedbound, began gasping for air.
I said, would y'all please call the ambulance? No, we're not going to call. I said, yes, you are.
Emergency room doctors diagnosed Ruby with pneumonia and severe sepsis. She had also developed these bed sores on her heels, wounds the family says Oakland Heights staff hid from them.
They wasn't even turning her. It's like they didn't give a doggone.
Oakland Heights is operated by Aspen Skilled Healthcare, a for-profit chain of more than 24 California nursing homes. Our CBS News investigation found in 2022, Aspen facilities moved more than $25 million, much of it Medicare and Medicaid reimbursements to companies related to Aspen.
Nursing home ownership has become very complicated.
Last year, the Biden administration forced individual nursing homes to disclose more information about their owners. But Harvard professor David Grabowski told us that still doesn't explain where taxpayer money is flowing.
Does Aspen have particular investors? There's no ability to peel that back with the federal data. Basically, we need to know for every nursing home in the country how they're spending public dollars.
Research suggests within the nursing home industry, extracting profit through payment of inflated rents and management fees to related companies is widespread.
So how did things change when Aspen took over operations?
For the most part, I would say the care became suboptimal.
Dr. Takeshi Matsumoto is a private physician who sees some of his patients in this LA nursing home, which Aspen took over from a nonprofit in 2016.
Just taking care of some basic needs, like, for example, taking care of the residents' dentures. The dentures were still caked with old food.
I just feel like she suffered.
Maisha and Yolanda told us Ruby's wounds never healed. She died last year, 5 months after she left Oakland Heights. They've sued Aspen, alleging the company knowingly and deliberately understaffed and unfunded Oakland Heights to maximize profits at the expense of patient care.
If you had an opportunity to address the folks at Aspen Skilled Healthcare, what would you say to them?
What if the shoe was on the other foot? If it was your loved one and your loved one wasn't being treated correctly?
Aspen Skilled Healthcare declined to comment for this report. In a court filing, the company denied all of Maisha and Yolanda's allegations. Nor in a statement, an industry lobbying group said financial moves like the ones Aspen made were common business practices to help streamline services, and notes there have been thousands of closures, ownership changes, and bankruptcies in recent years.
New data released today shows a staggering surge in the number of Americans turned caregivers for sick or elderly family members. A new AARP report says nearly 1 out of 4 American adults has taken on that responsibility. For tonight's interview, we are joined by AARP CEO, Dr. Maisha Jordan. Dr. Jordan, thanks for being with us. A 50% increase in home caregivers. What accounts for that jump?
Sure. So, I mean, what we have is we've reached a crisis point in our country for our nation's 63 million caregivers. What we have is a confluence of a number of things, one of which is that we are aging as a population within the U.S. We have a number of individuals who actually are identifying themselves as caregiving as we are talking about this issue more. Additionally, we're finding that the issue of complexity is becoming more and more of a concern. The number of years that we're living longer, but we're not living healthier. And so we have more medically complex people who are requiring care for their loved ones that's contributing to this crisis that we're experiencing today.
Right. So not just more, but more difficult. Give us a sense, help people understand what life is like as a caregiver or a typical instance, although, of course, obviously nothing is typical.
Exactly. Everyone's situation is very different, but ranging from individuals that I've met, some of our members themselves who called us and who I've had the opportunity to interview. I think of a woman named Ana Tris who I met with in Florida. She has a mother who has dementia and who she loves dearly and wants to care for, but is facing issues in terms of the rising cost of financial burden that caregivers face, up to over $7,000 a year for many caregivers, to the fact that she has to now coordinate her mother's care. She has to use her own retirement savings to take care of her mother. So we're experiencing that in many different ways. And obviously those who are lower income, who live in more rural areas, have less access to care, less access to services. But one of the reasons that we are partnering with the United Way is to be able to do just that, provide access to care and services through our 211 service that we've rolled out in 25 states around the country.
And Dr. Jordan, a number of those people caring for parents are parents themselves, so they've got kids on the other end of the age spectrum.
That's right. We have what we call the sandwich generation, individuals who are caring for young children as well as older parents. And in terms of our survey, we identified over 18 million individuals who fall into that category who are dealing with just that. We also know that at every point in life, we will either become a caregiver or need caregiving. And most support loved ones without pay, often taking time from work or from their other family needs. So this is indeed a crisis that we need to continue to act very swiftly on. We're focusing on passing state caregiver tax credits. We're focused on providing services through our affiliation with the United Way, through our 211 service. And we're also focused on highlighting home-based care and some of the technology that can support that.
You mentioned home-based care. I mean, because give us a sense of training a little bit. I mean, how do we know how to care for our parents? I mean, so.
I know.
Yeah. Talk about that a little.
It's such a challenge. We have so many individuals, over 63 million caregivers in the U.S., an increase of over 20 million from 10 years ago, dealing with medical complex issues that they have no training for. And so one of the issues that we've surfaced from our members, hearing from Americans across the country, is that they need support, they need training. And again, part of our partnership with the United Way is helping to do that, but we're also fighting for additional resources, working with different states. Oklahoma became the first state to pass a tax credit for caregivers in 2023. Nebraska soon follows. We know that several states, at least 9, have since introduced tax credits this year that help provide that essential support, but training continues to be a significant issue.
About 1 in 7 senior citizens are veterans. In their later years, many of them face challenges to get the care they need. Now, the Department of Veterans Affairs is exploring a way to help. In tonight's Eye on America, CBS's James Brown reports on an approach that relies on the time-honored idea that there's no place like home.
Chantel Cross and her 2 kids set 3 extra places for dinner.
You want more, Charlie?
And Charles McCoubry, Peter Samaras, and Eckhart Teese couldn't be happier to have a seat at the table.
I like living here.
The 3 men are part of what's called the Medical Foster Home Program.
You gonna play catch with Charlie?
An innovative approach to an old problem.
Oh, we catch it, Pete.
Taking care of veterans who need extra care later in life.
Give me what some of the advantages are of living here in a home as opposed to a nursing facility.
It's nice here, and being in a nursing home, they just throw you away. They ignore you. But here we're like part of the family.
All 3 men served in the military in the late 60s and early 70s. Charles in the Navy, Peter and Eckhart in the Army, which is the subject of some good-natured ribbing in their home.
What do you guys like about each other?
Nothing. He's like a brother to me, yeah.
Good job.
Chantel's career began in a nursing home, but she realized she could provide a more comfortable environment in her home.
Very good.
Medical professionals and social workers visit the vets.
I know you're doing it, Charlie.
Chantel also takes them to services outside the home.
The daycare center they go to is wonderful. We take the guys out to the mall, let them do some walking. Somebody might want coffee. We get them ice cream.
Our caregivers treat the veterans as their own family.
Dana Cooper is the VA's Director of Home and Community Care. She oversees the Medical Foster Home Program.
The caregivers have to live in the home with the veteran, and so we really see that family bond and relationship.
It takes a different person to do this, Ms. Cooper.
Yeah.
Why?
I believe that every veteran has a right to remain and age in place and be with people who surround them with love.
Almost half of the veteran population is 65 and over. Nursing homes can cost over $100,000 per year out of pocket. The Medical Foster Program costs vets less than half that. Caregivers receive, on average, $2,800 per month from each veteran living in their home.
Chantel, what do you get out of this?
A lot. It gives me a peace of mind to know that I'm able to help others and give back. I love helping others and I love giving back.
The program began in 2002 in Arkansas, Florida, and Puerto Rico. Today, it's found in 47 states where over 700 veterans receive home care from approximately 500 caregivers.
How long do you envision yourself doing this?
Forever. I don't ever want to stop.
Any veteran enrolled in the VA system is eligible for this program.
You understand?
A program that serves as a powerful reminder about the healing power of home. For Eye on America,
Hey, Charlie.
I'm James Brown in Baltimore.